with regards to our COVID management here is that we have escalation of cases, and our holding bay can take a maximum of 2. And we don't want to miss out the suspected cases with those who are not suspected. So we fortunately have a ward, the VIP ward, which has 2 wings. We have the East Wing and the West Wing. The East Wing is separated from the West Wing in terms of everything. They have cubicles, 1 per room. They have their own toilet, their own bathhouse and everything. So when we see a patient at the OPD and the patient has difficulty in breathing, a temperature or anything, that will give us a hint of suspicion of COVID. We bring the patient to the East Wing. Each patient has his own room, and we screen the patient and we take the samples. When the results come and we are certain that the patient is negative, before we transfer the patient to the rest of the ward. So this is how we manage so that we don't miss out the patient with this. Those are not COVID. So you can have a look at the way the design is. We have individual rooms with their own everything at this wing. They don't interact with the people on the other wing at all. They are here till we take care of them and we discharge them. So that's how we manage the cases on this floor for now. And as I said, we have a holding bay, but we can take only 2 beds. So, and now we have cases, as I'm talking, we have 3 cases here. So once the holding bay is full, we transfer all the suspected cases here till they are discharged. Fortunately, most of our suspected cases that we've had in the past turn out negative. But it is safer to keep them here till they turn out negative before, if they are not well to go home, we send them to the rest of the world. So they don't interact with the non-suspected cases at all. That does not mean the non-suspected may not have COVID. We treat everybody as a potential COVID cases. But once we have symptoms, that is suggestive, you don't go near the non-suspected, we keep you here. And as I said, by the grace of God, most of them that we've tested in the past turn out to be negative. But we don't want to take the chances now. That's what we do. We have everything. We've never run out of PPE since the COVID started till date. That one, by the grace of God, we get adequate supply. Okay. So this is what was brought in the morning. We call this one Isabella Park, and it is impervious. I mean, when you remove it, you pour water into it, it doesn't go through. So when we are operating, we use this for surgical operation. When we are operating with Isabella Park, we don't even wear apron on top because they design it, they've lined the inside, making it impervious. So we are okay. Well,
it is not true that staff have not been given any training for COVID. When the pandemic broke out, we were all trained at the morning meeting. It was done on various days continuously for everyone. And the training was done by the infection prevention manager about the preventive measures to take during the pandemic, how to wear the protective equipment, and the precautions we have to take, general precautions we have to take, hand sanitizing, how to gown, how to remove the gowns, the face mask, and all that. And if there's the need for sample to be taken, those who will be invited, how they will also gown and take the samples. He told us all that.